Today we are discussing oral health for the older person, ensuring dignity, health, and quality of life in aged care. Oral health goes far beyond just a nice smile. It is intrinsically linked to a person's overall well-being and their ability to age with dignity. It impacts three major areas of daily living. First, nutrition. Pain-free chewing is vital for preventing malnutrition. Second, communication. Healthy teeth and dentures support clear speech. And third, confidence. A clean mouth promotes social engagement and self-esteem. There is a profound systemic connection between the mouth and the whole body. Poor oral hygiene allows harmful bacteria to colonize the mouth. For frail residents, this can lead to severe health issues. In the lungs, aspirated bacteria can cause aspiration pneumonia. There are also cardiac links, as periodontal disease is connected to cardiovascular issues. Furthermore, gum disease makes blood sugar management significantly harder for residents with diabetes. To manage this, we use the Oral Health Assessment Tool, or OHAT, as our primary clinical guide. It covers 8 categories of inspection. We check lips and tongue status, gums and oral tissues, saliva flow for xerostomia, natural teeth and denture fit, and signs of oral cleanliness and pain. Each category is scored from 0 to 2. 0 means healthy, 1 indicates changes, and 2 means unhealthy. If a resident scores a 1 or a 2 in any category, please organize for a dentist to examine them. Daily care for natural teeth requires standard brushing at least twice daily, specifically in the morning and before bed, using a soft toothbrush. Focus heavily on the gum line, where plaque accumulates most. Always use a high fluoride toothpaste to protect aging enamel. And don't forget to gently brush the tongue to remove bacteria that cause bad breath and pneumonia. For residents with dentures, follow these crucial care rules. First, nightly removal is essential. Gums need air to prevent fungal infections like thrush. Second, never use regular toothpaste, as it is abrasive and scratches acrylic. Instead, use mild soap or a dedicated denture cleaner. Finally, safety first. Always clean dentures over a towel or a sink filled with water to prevent breakage if they are dropped.
There are different types of dentures: metal, plastic, some that replace all teeth, and others that replace one or a few teeth. Dentures should be regularly removed and rinsed to remove food debris, and cleaned thoroughly at least once during the day to help prevent fungal infections. The denture should be safely removed, either by the wearer of the denture or a carer, and placed in a bowl or denture container. For a patient who needs help removing a denture, wash hands and put on gloves. For an upper denture, slip finger by side of denture to break the seal and lift the denture out of the mouth. Do the same for a lower denture. If there are clasps on a denture, push them up for a lower denture and down for an upper denture. Partial dentures can sometimes be tricky to remove. Fill a bowl or sink with water. The denture should be brushed over a bowl to prevent breakage, with a denture brush or toothbrush for natural teeth. The denture should be brushed using liquid soap or denture cleaning paste. Toothpaste can cause damage to the surface of a denture over time. All the surfaces need to be brushed. Next, thoroughly rinse with water to remove the debris and soap. If a fixative is required, the denture should be dried using a paper towel and a small amount of fixative applied to the contact area of the denture, and then the denture fitted back into the mouth. When not being worn, the denture should be stored in a named denture pot. It's important to clean the mouth and tongue when the denture has been removed, even if they have no teeth. Ideally, denture should not be worn overnight to let the lining of the mouth recover from wearing dentures during the day.
Xerostomia, or dry mouth, is a massive challenge. A lack of saliva is more than just uncomfortable. It actively destroys teeth. Over 400 common medications, including those for blood pressure, depression, and continence, are major culprits. Our support strategy should be to encourage frequent sips of water, use saliva substitutes, and strictly avoid alcohol-based mouthwashes that cause further drying. When caring for residents with dementia who may resist care or forget how to brush, use the tell, show, do method. First, tell. Explain every single step calmly. Next, show. Mirror the action or place the brush in their hand. Finally, do. Provide gentle hand-over-hand guidance. For your technique, remember that standing behind or to the side of the resident is much less invasive than standing directly in front of them. Be on the lookout for red flags that must be reported immediately. Watch for pain signs, such as a refusal to eat, pulling at the face, or increased agitation. Check for white patches, which indicate a possible thrush infection. Look for loose teeth, which pose a choking risk. Watch for bleeding gums, ulcers that do not heal within 14 days, and persistent bad breath. Joint stiffness from arthritis shouldn't mean a loss of independence. Simple modifications can help residents brush on their own. Slide a tennis ball over the handle to provide a larger surface area for easier holding, or use foam tubing to thicken the grip. Electric toothbrushes are also fantastic because they do the mechanical work for the resident. Ultimately, just 2 minutes of focused care can prevent weeks of oral pain and medical complications. Oral health is a basic requirement for good health.